The health system is on alert to detect potential cases and to respond promptly when they are confirmed. It shows that our systems are working. I want to impress upon everyone that although we now have a case in Canada, the risk to Canadians remains low. We are aware that the number of cases are increasing in China, but there are very few exported cases. Person-to-person spread has been reported in close contacts.
The patient, when he became ill, more ill, that he realized he needed medical support, in fact, followed all of the information provided at the airport. In fact, provided information to the first responders that he had recently returned from Wuhan. So the first responders were able to respond wearing protective gear and were able to alert the hospital to which he was being transported, Sunnybrook, that in fact, the patient was indicating that he had returned from the area under question. So for me, that is a sign that the information at the border did actually percolate through to the patient and his family, and that in fact, he provided appropriate information to his medical team, as it were.
Based on the scientific information about coronaviruses, these are spread by droplets on the whole. So these land in a certain distance, if you like. And so in a plane contact tracing perspective, we're looking at a 2-meter radius. So of course, we'll be looking at the plane and its seating plan and where that patient was actually seated in order to trace the people who are surrounding, or the passengers surrounding that. The main focus, of course, is on the actual fellow travelers, because they have been in the most close and prolonged contact as well, or anyone who may have administered some sort of care to a passenger. And also informing the airlines and the airline staff who may have been serving that particular zone or cabin as well. And then for the rest of the plane, if you don't get a call from public health authorities, it means you were not right next to that 2-meter radius of that particular patient. And you should take the information that you would have received at the border from the Public Health Agency of Canada as to what you should do if you develop symptoms and you should get sick. You should sort of have any symptoms to call ahead to your health providers.